What is heat stroke? I am Dr. Nadeem Sajjad Raja. Our body usually can easily regulate its temperature. When the body gets too hot, it uses several techniques to cool down, including sweating. But if a person spends too much time in the heat without taking enough fluids, the body cooling process can't work properly. When there is a shortage of water in the body, it can no longer cool itself by sweating. When this happens, body temperature can rise high enough to make the person sick. Heat stroke is an emergency, serious, potentially life-threatening form of heat illness. The body temperature rises to 100 degrees Fahrenheit or 40 degrees Celsius or even higher. Person develops neurological changes such as mental confusion, unconsciousness. At these high temperatures, body proteins and the membranes around the cells in the body, especially in the brain, begin to be destroyed or malfunctioning. The extreme heat can affect internal organs, causing breakdown of the heart muscles, cells, and blood vessels, damage to internal organs, and death. There are two types of heat strokes. Exertional heat stroke occurs when someone is vigorously active in a hot environment, such as playing sports on a hot summer day or participating in military training activities. It typically strikes youngs. Non-exertional heat stroke tends to occur in people who have a diminished ability to regulate body temperature, such as elderly, very young children, or people with chronic illness. Factors that can contribute to heat stroke include not drinking enough water, wearing bulky or heavy clothes, being overweight, sleep deprivation, which can decrease the rate of sweating, moving from a cooler climate to a warmer body, so body is not acclimatized with the hot weather, some medications, being confined to a poorly ventilated or non-air conditioned living space, having had heat stroke in the past, use of illicit drugs, for example, cocaine, heroin, amphetamines, ecstasy. So what are the signs and symptoms of heat stroke? It's very important to notice these: abdominal cramps, muscle cramps, nausea, vomiting. Person experiences severe headache, dizziness, cannot keep balance, feel weak, heavy sweat or a lack of sweat. So when heat stroke starts, neurological symptoms can appear, which normally include odd or bizarre behavior, irritability, delusions, hallucinations, seizures. So all these are treatable, and even person can go into coma. So how heat stroke is diagnosed? So full examination by the doctor. So doctor usually checks temperature, imaging such as computed tomography, blood tests, urine tests, kidney function tests are done. So, and patients with a heat stroke, they take several months to recover. So how we can prevent heat stroke? Drink plenty of water, stay indoor, wear light clothes, avoid vigorous exercise during hot weather, drink less caffeine, alcohol, recognize early signs of heat stroke. So treatment, seek medical help. That is very important. Call healthcare facility, remove patient from hot area, reduce body temperature, remove unnecessary clothing, water spray, cool air, wrap in cool clothes, use ice packs, medication on the advice of doctor, for example, seizures, to treat seizures. Prognosis is usually good if it is picked up, diagnosed early, and treated early. Thank you very much for watching this video.